How do you say your last name?
Paradon. Yeah, Jeffrey, me, Dominique, Noelle, and Stephanie.
Definition: inflammation of the fluid-filled sac that lies between a tendon and skin or between a tendon and bone. The condition may be acute or chronic.
Symptoms: joint pain and tenderness, swelling, warmth over the joint.
What a shame.
Lucia, fluid-filled cavities near joints where tendons, muscles passes over body projection.
Bony projection.
Assist movement and reduce friction between parts caused by chronic overuse, trauma.
I was laughing.
Rheumatoid arthritis.
Gout or infection
Stop being mean.
that cause massive permanent. Chronic inflammation can occur with repeated injuries or attacks of bursitis. There occurs commonly in shoulder, knee, elbow, and hip. The Achilles tendon and foot are other areas where this can occur.
Okay, my turn. And they have like 4 different types of bursitis, so we're gonna go through each one. Okay.
Bursitis of the knee. Each of the knees has 11 bursae. While any of these bursae can become inflamed.
Speak up.
Don't blush either.
Bursitis most commonly occurs over the kneecap or on the inner side of your knee below the joint. Knee bursitis causes pain and can limit your mobility. Treatment for knee bursitis often includes a combination of self-care practices and doctor-administered treatments to alleviate pain and inflammation.
Why are your shoes tied double
These are the little sacks right here.
It's not fun. I'm hard to untie.
Bursitis of the hip.
That's like your stomach.
Yeah.
Your
Hip,
right there.
hip.
Hips. Your hip.
My hip.
That's.
Uh,
Oh my god.
hip bursitis is a common problem that causes pain over the outside of the upper thigh.
That was your. That was your hate.
A bursae is a fluid-filled sac that allows smooth motion between 2 uneven surfaces. For example, in the hip, a bursae rests between the bony prominence over the outside of the hip, the greater trochanter, and the firm tendon that passes over this bone. When the bursal sac becomes inflamed, each time the tendon has to move the bone, a boo-boo results. Patients with hip bursitis move this tendon with each step. Hip bursitis symptoms can be quite hurting.
Painful. Dang, this shit is slide on the poor kid.
God.
You need to do some mistakes, actually. Go down again. You didn't say nothing yet. Oh my God, bursitis of the shoulder. The most common locations for bursitis are in the shoulders, elbows, or hips. But you can also have bursitis by your knee, heel, and the base of your big toe. Bursitis often occurs in joints that perform frequent repetitive motion. Treatment typically involves resting the affected joint and protecting it from further trauma. In most cases, bursitis pain goes away within a few weeks with proper treatment, but recurrent flare-ups of bursitis are common.
Bursitis of the elbow. The elbow contains a slippery fluid-filled sac called the bursa to help the skin slide over the bone in that area. The bursa covers the non-process. It lies between the skin of the elbow and the bones of the forearm.
Okay, treatment. Your healthcare provider may recommend temporary rest or immobilization of the affected joints. Non-steroidal anti-inflammatory drugs such as ibuprofen may relieve pain and inflammation. Formal physical therapy may be helpful as well. If the inflammation does not respond to the initial treatment, it may be necessary to draw out fluid from the bursa and inject corticosteroids. Surgery is rarely required. Exercise for the affected areas should be started after the pain resolves. If muscle atrophy, which is weakness or deficiency, has occurred, your healthcare provider may suggest exercises to build strength and increase mobility. Bursitis caused by infection is treated with antibiotics. Sometimes the infected person must be drained surgically.
Taking out my gray hair, small.
Prognosis.
It's too many to pick.
The condition may respond well to treatment, or it may develop into a chronic condition if the underlying cause cannot be cured.
Just sit it on the table.
Prevention. Avoid activities that include repetitive movements of any body part below property.
Complications. Chronic bursitis may occur. Too many steroids injections over a short period of time can cause injury to the surrounding tendon.
The end. Woo!
The end? Was it a story?
Yeah.
That was a boring story.
Yours was boring.